Hepatitis A is a liver infection. It is caused by a virus. This virus is called Hepatitis A virus, or HAV is contagious. This means it can spread easily from person to person. HAV causes inflammation. This inflammation affects the liver. The liver is a vital organ. It helps your body process food and remove toxins. Hepatitis A can cause mild to severe illness. Some people have no symptoms. Others experience fever, fatigue, and jaundice. Jaundice is a yellowing of the skin and eyes. Most people recover fully from hepatitis A. However, it can rarely lead to liver failure. This is why prevention is crucial. Hepatitis A is primarily spread through ingestion of contaminated food or water. The virus can also be transmitted through close contact with an infected person. This is why maintaining good hygiene is essential. Washing hands with soap and water before eating and after using the restroom can significantly reduce the risk of infection. Ensuring that food is cooked properly and avoiding raw or undercooked shellfish can also help prevent the spread of HAV. Vaccination is another effective way to prevent hepatitis A, the hepatitis. A vaccine is safe and effective, providing long-term protection against the virus. It is recommended for children, travelers to certain countries, and people at higher risk of infection. If you are traveling to areas with higher rates of hepatitis A, getting vaccinated is especially important. Consult with your healthcare provider about the vaccination schedule and any other precautions you should take. Being informed and prepared can help you stay healthy and enjoy your travels. Remember, hepatitis A can affect anyone, regardless of age or health status. Early detection and treatment are key to managing the infection and preventing complications. If you suspect you have been exposed to hepatitis A or are experiencing symptoms, seek medical attention promptly. Rest, hydration, and a healthy diet can aid in recovery. Avoiding alcohol and certain medications that can strain the liver is also important. Taking care of your overall well-being can support your liver health and help you recover more quickly. Regular exercise and a balanced diet can strengthen your immune system and improve your overall health. By taking these steps, you can protect yourself and others from hepatitis A and enjoy a healthier life. Remember, knowledge and prevention are your best defenses against hepatitis A. Stay informed, stay healthy. Hepatitis A spreads through fecal-oral transmission. This means that the virus is present in the feces or stool of an infected person. When an infected person uses the restroom and does not wash their hands properly, they can spread the virus to anything they touch afterward. This can include food, water, and surfaces that other people come into contact with. The virus can contaminate food or water sources, making it easy for others to become infected. For example, if sewage water containing the virus flows into a river or other water source, it can contaminate the water supply. People who drink this water or use it to wash food can then become infected with hepatitis A. It can also contaminate food directly. If an infected person prepares food without washing their hands properly, the virus can be transferred to the food. This is especially common in settings like outdoor picnics or street food markets, where food is often prepared and served in less controlled environments. You can get hepatitis A by eating food prepared by someone who has not washed their hands properly after using the toilet. Drinking contaminated water is another common way to contract the virus. In areas with poor sanitation, the risk of contaminated water is higher, making it important to ensure that water is clean and safe to drink. The virus can also be spread by touching your mouth after touching contaminated surfaces. Public places like playgrounds, parks, and public transportation can have surfaces that are touched by many people throughout the day. If an infected person touches these surfaces, the virus can be left behind and picked up by others who touch the same surfaces. Close contact with an infected person can also spread the virus. This includes activities like hugging, shaking hands, or even sharing utensils or personal items. In family gatherings or social events, the virus can spread quickly if proper hygiene practices are not followed. The hepatitis A virus is quite resilient and can survive on surfaces for months. This means that even if an infected person touched a surface weeks ago, the virus could still be present and capable of infecting someone else who touches the same surface. It is resistant to many common disinfectants, making it difficult to eliminate completely. Regular cleaning and disinfecting of surfaces, especially in public areas, is crucial to reduce the risk of spreading the virus. However, not all disinfectants are effective against hepatitis A, so it's important to use products that are proven to kill the virus. This makes hand washing extremely important. Washing your hands thoroughly with soap and water for at least 20 seconds can help remove the virus and prevent it from spreading. Hand washing is especially important after using the restroom, before eating, and after touching potentially contaminated surfaces. By practicing good hand hygiene, you can protect yourself and others from hepatitis A. The most effective way to prevent hepatitis A is vaccination. Hepatitis A is a highly contagious liver infection caused by the hepatitis A virus. It can cause mild to severe illness, and in some cases it can lead to serious liver problems. The virus is usually spread through ingestion of contaminated food or water, or through direct contact with an infectious person. Given its contagious nature, vaccination is crucial in controlling its spread. The hepatitis A vaccine is safe and effective. It provides long-term protection. The vaccine works by stimulating the immune system to produce antibodies against the virus, which helps the body fight off the infection if exposed in the future. Clinical studies have shown that the vaccine is highly effective in preventing hepatitis A infection, with protection lasting for many years, often for life. The CDC recommends the hepatitis A vaccine for all children at age 1. This early vaccination helps protect children from the virus during their formative years when they are most vulnerable. Vaccinating children not only protects them but also helps prevent the spread of the virus within the community, contributing to herd immunity. People traveling to countries where hepatitis A is common should also get vaccinated. Travelers are at a higher risk of contracting the virus due to differences in sanitation and food safety standards. Getting vaccinated before traveling can prevent the inconvenience and potential health risks associated with contracting hepatitis A abroad. Individuals with chronic liver disease are particularly vulnerable to severe complications from hepatitis A. For these individuals, the infection can exacerbate their existing liver conditions, leading to more serious health issues. Therefore, it is especially important for them to receive the vaccine to protect their liver health. Men who have sex with men are also at increased risk for hepatitis A. This group has been identified as having higher rates of infection, making vaccination a key preventive measure. Public health initiatives often focus on increasing awareness and vaccination rates within this community to reduce the spread of the virus. People who use injection drugs are another high-risk group. Sharing needles and other drug paraphernalia can easily transmit the hepatitis A virus. Vaccination programs targeting this population are essential in preventing outbreaks and protecting individuals from infection. The vaccine is given in 2 doses. The first dose primes the immune system, and the second dose, which is a booster, ensures long-term protection. This 2-dose schedule is designed to provide the best possible immunity against the virus. The second dose is given 6 to 12 months after the first dose. This timing allows the immune system to build a strong and lasting defense against hepatitis A. It is important to complete the vaccination schedule to ensure full protection. Talk to your doctor about getting vaccinated. Your healthcare provider can give you more information about the vaccine, assess your risk, and help you decide the best time to get vaccinated. Protect yourself and your loved ones by taking this important step towards preventing hepatitis A. Hand washing is one of the most effective ways to prevent the spread of germs, including wash your hands thoroughly with soap and water before, during, and after preparing food. Before eating food, after using the toilet, after changing diapers, and after touching garbage, wash your hands. Use warm water and lather soap for at least 20 seconds. Rinse your hands well and dry them with a clean towel. Section 5. Safe food and water habits. Food and water safety is crucial to prevent hepatitis A. Follow these tips. Wash fruits and vegetables thoroughly under running water. Cook food to the recommended internal temperature. Avoid eating raw or undercooked shellfish. Drink bottled water or boil water for at least 1 minute before drinking. Be cautious when traveling to countries with poor sanitation. Avoid eating food from street vendors. Section 6. Traveling safely. Travelers to countries with high rates of hepatitis A should take extra precautions. Get vaccinated at least 2 weeks before your trip. Pack hand sanitizer and use it frequently. Avoid drinking tap water or using ice in drinks. Be careful with food choices. If you are unsure about the safety of food or water, err on the side of caution. Choose cooked foods and bottled drinks. Section 7. Post-exposure prophylaxis. If you have been exposed to hepatitis A, there are steps you can take to reduce your risk of infection. This is called post-exposure prophylaxis. Post-exposure prophylaxis may include hepatitis A vaccine. If given within 2 weeks of exposure, it can prevent infection. Immune globulin. This is a shot of antibodies that can provide short-term protection. Contact your doctor immediately if you think you have been exposed to hepatitis A. Section 8. Community and public health actions. Public health measures play a vital role in controlling hepatitis A outbreaks. These measures include surveillance tracking cases of hepatitis A to identify outbreaks early, vaccination campaigns targeting high-risk groups for vaccination, education and outreach, raising awareness about hepatitis, prevention, sanitation improvements, ensuring access to safe water and sanitation facilities. By working together, we can reduce the spread of hepatitis A and protect our communities. Section 9. Taking charge of your health, preventing hepatitis. A is everyone's responsibility. By following these simple tips, you can protect yourself and your loved ones. Get vaccinated. Wash your hands frequently. Practice safe food and water habits. Be cautious when traveling. Seek medical attention if you think you have been exposed to hepatitis A. Remember, your health is in your hands. Take the necessary steps to prevent this preventable disease. For more information about hepatitis A, talk to your doctor or visit the CDC website.